I'm 24 weeks pregnant today, and at my 20-week ultrasound, I got a diagnosis that I was not expecting: complete posterior placenta previa. Now, this is not something that I've shared recently, but I think it's so important to talk about because placenta previa is incredibly common, and so many people don't know what it is. It's actually so common that in the second trimester, 1 in 20 pregnancies will be diagnosed with placenta previa, and 1 in 200 pregnancies will have that progress into the third trimester and progress to the time of delivery. So, what is placenta previa? Placenta previa is when the placenta completely covers the cervix during pregnancy. In a normal, healthy pregnancy, we really want the placenta to be at least 2 centimeters away from the cervical os. When it's lying too low in the uterus or covering the placenta altogether, like in my case, it puts you at a significantly increased risk of complications during pregnancy, complications during delivery, as well as a lot of vaginal bleeding in the second and third trimester. Now, when the placenta is covering the cervical os or again too low in the uterine cavity, it's not safe or recommended to have a vaginal delivery. The recommendation is to actually have a scheduled C-section, typically between the weeks of 36 and 37. And the reason being is because we don't want you to go into labor on your own. If you go into spontaneous labor with placenta previa, you have a significant increased risk of having vaginal bleeding and hemorrhage during delivery. Now, I already had a scheduled C-section with Teddy, my first pregnancy, so I was planning on having a repeat section with this pregnancy, but I was not planning to have it as early as 36 to 37 weeks. So, of course, we have to modify and do whatever is safe and recommended for both me and my baby. So this is not a diagnosis that I was expecting to hear, or quite frankly, one that I was wanting to have, but here we are, and we have to move forward with modifications during my pregnancy to make sure that I'm being as safe as possible. So continue following along during my pregnancy journey where I talk about restrictions and different limitations that I have during this pregnancy, and if there's a chance that my placenta can move up and resolve on its own. So make sure to stay tuned for part 2.